Answering President Barack Obama's call to reform our nation's healthcare system, Congresswoman Mazie Hirono hosted a roundtable discussion in Hilo that featured a number of island leaders in the fields of medicine, business and labor, health insurance, and Native Hawaiian affairs.
This is very exciting in the sense that this issue, which we have been talking about and focusing on, the cost of health care, accessibility, choice issues, and the quality of care have been with us for a long time, but it truly is the first time that the President of the United States has put health care reform on the minds of all of us. There's nothing like the President saying, we're going to deal with health care to focus us on the issue. And when a group of us met with him a couple of weeks ago in the White House, he said that health care changes and reform is at the top of his agenda for the next 6 months.
More than 70 people attended the forum, and while the desire for healthcare reform appeared simple enough, panelists acknowledged finding meaningful solutions present tough challenges.
I don't think this process can be pain-free, and I know that's very politically difficult, but there is no way to get good, high-quality, good access at lower costs. We're gonna have to give somewhere.
We want to see quality care. We want to see access, especially on the neighbor islands, because we're a statewide chamber, and we want to see reduced costs. I know we're looking at our budget for next year. We're on a fiscal year. Ours are going up 14%. I was at a meeting yesterday with a larger company. They're going up 20%. These costs are really strangling businesses.
What won't work, and has never worked on a sustained basis, is pushing down reimbursements to physicians and hospitals. It just doesn't work. The second thing that won't really reform healthcare is focusing on waste and fraud and abuse. It makes great headlines, but it doesn't get at the core issue. The core issue is quality.
Particularly here on the Big Island, we have 5 public hospitals. They do not turn away patients. They do not get reimbursements at the levels that they need. They're going to be in the red ink constantly unless there's some kind of change.
The roundtable also addressed America's shortage of doctors, nurses, and medical technicians, a trend that has even touched the island of Hawaii. Panelists say this issue will be especially pronounced as the current community of healthcare providers begins to retire.
We probably won't be able to train enough physicians nationally to meet the needs. We do have to look at other providers, but even there we are short.
I think opening the door to foreign medical school graduates and including nurse practitioners and other physician assistants, I think being embracing of that as a source of additional practitioners.
The clock is ticking. The president is pushing Congress to have comprehensive health care reform legislation delivered to him by this fall.
All is coming to a head pretty fast, amazingly enough. And as I said, the House leadership is saying that we want to address or deal with this issue in the form of a bill that we can vote on in a pretty short time frame. We're talking June and July, amazing as that may sound. So your help is much appreciated. We will keep you informed as we get more information. Thank you so much for being here. It means a lot to us. Thank you very much. Aloha, and thank Andy.